Welcome, everybody, to today's webinar, Strategies for Implementing a Stock Asthma Medication Program in Schools. My name is Barbara Kaplan, and I am the National Director for Asthma Programs here at the American Lung Association. And I'm really pleased to be joined by an esteemed panel of experts to help talk about this discussion today. So before I get started, I do want to make some acknowledgments. Earlier this year, I had the opportunity to bring together a group of stakeholders to talk about asthma medication in schools. So people with lots of experience implementing stock asthma medication programs. All of this work was made possible from a CDC-funded project to improve access to asthma medications in schools. So we brought together these stakeholders to talk through, once states have laws in place, that it is sometimes difficult to get stock asthma medication programs established in the schools and school districts. And so the purpose of this expert group was really to develop some guidance for states and school districts implementing stock asthma medications. We identified challenges and pitfalls that schools and school districts experience with stock asthma medication implementation. And we also discussed strategies to overcome these barriers. And we started to develop some resources that could help. So I'd love to introduce Pam Collins, Deputy Branch Chief at the Centers for Disease Control, National Center for Environmental Health, just to share a few opening remarks. Hi, Pam.
Thank you, Barbara. Welcome, everyone, to the American Lung Association's 2023 Back to School with Asthma. To kick off this season, we'll be discussing strategies for implementing a stock asthma medication program in schools webinar. As we are aware, stock asthma rescue medication policies authorize school districts to maintain unassigned albuterol and enable trained staff members to administer the medication. Stock asthma rescue or reliever medication laws serve as an important fail-safe measure. Now I'll turn it back over to Barbara.
Thanks so much, Pam. All right, so asthma is one of the most common reasons that children miss school. So ensuring that schools are equipped with emergency asthma medications and the personnel trained to administer the medication really becomes essential. So in this webinar, we hope to dive into the benefits, challenges, and give you some actionable strategies related to implementing a program. I've been joined today by an incredible group of passionate individuals working on implementing stock asthma medication programs in their states. And so they will share their experiences and lessons learned, tackling some of the most common barriers that schools face when trying to implement a stock asthma medication program. We'll start by talking through some of the benefits of implementing a stock asthma medication program. Then with our panel discussion, we'll get into navigating some of the barriers to obtaining standing orders, sourcing albuterol and related medical supplies, talking about financial complexities of really setting up your program, understanding the importance of adequate training, and discover some resources and best practices. And lastly, around understanding the importance of data collection, data management, and being able to raise awareness about our stock asthma medication programs. All right, so this webinar is also part of our Back to School with Asthma campaign. I'd love to introduce Cindy Trubisky, our National Senior Director for Asthma Programs here at the American Lung Association, to highlight a few of our key focus areas for our Back to School with Asthma campaign.
Oh, fantastic, Barbara. Thanks so much. And welcome, everybody. We're so excited to have you here today. Each year, as Barbara mentioned, at this time of the year, we at the American Lung Association have a Back to School with Asthma educational campaign. And this year's campaign is focused on creating awareness among parents, children, young adults, school nurses, and other school employees on the steps that they can take to ensure that children with asthma and young adults with asthma remain safe and healthy throughout the 2023 to 2024 school year. So we invite you to learn about asthma with Asthma Basics, get trained to deliver or participate in one of our self-management education programs, such as our Open Airways for Schools, our Kickin' Asthma program, our Breathe Well, Live Well program, and then finally, to improve and implement asthma-friendly policies and practices. So this year's goals are to raise awareness about the importance of vaccines, and that includes our influenza vaccine, pertussis, RSV, and COVID-19. And we're going to raise awareness of the resources available to children with asthma, parents, and school health professionals, and raise awareness, finally, about the importance of creating safe and healthy learning environments by using Asthma-Friendly Schools Initiative frameworks, a model that we know works. So a part of this tactic is to ensure that students have immediate access to their asthma medications while at school and during school-sponsored events. Can you advance the slide, Barbara?
One slide for
Thank
you.
you.
There you go.
Okay, so do you or your child have healthcare coverage through Medicaid or Children's Health Insurance Program, or CHIP? So over the last few months, states restarted Medicaid and CHIP eligibility redeterminations for the first time since the start of the COVID-19 pandemic. So this means make sure to update your information with your state Medicaid program. Watch for mail from Medicaid and complete the renewal form right away if you get one. You can visit lung.org/healthcare for fact sheets, videos, and other resources in English both and Spanish too to help you navigate this process. So very important. And then as we start off today, I want to bring your attention to this year's Back to School with Asthma resources. There's a toolkit for school professionals and personnel, updated school asthma in schools, the basics for parents, that's our landing page, and on our website, and a checklist for parents for good measure. So we also invite all participants to visit or revisit our newly updated and relaunched Asthma Basics online course. It's very exciting. So now I'm going to hand over the presentation to Barbara to continue our discussion today. And I thank you again for attending today's webinar. Barbara?
Great. And I do want to just let folks know that at the end of today's webinar, I will be sending some of the links that are presented today. So if you miss clicking on a link, don't worry, we'll be sure to send that out to you. So now it gives me a great pleasure to introduce our first speaker, Dr. Andrea Papalardo, who practices allergy immunology at the University of Illinois at Chicago. Dr. Papalardo specializes in the care of adults and children with asthma and allergies. She works with her patients to find the best, most comprehensive approach to their medical care. And she believes that family, physicians, and medical neighborhoods should work together in addressing allergy and asthma problems. Dr. Papalardo is an allergist and the medical director of the Mobile Care Chicago Asthma Van, which provides free allergy and asthma subspecialty care in front of Chicagoland schools. She recently received a grant to support stocking albuterol for children with asthma in Illinois from the American Lung Association. So welcome, Dr. Papalardo.
Thank you so much to Barbara and Cindy and the American Lung Association for having me today. I always love speaking about what I'm passionate about, and this is one of those things. One of the things that Cindy had mentioned was that we want asthma-friendly schools, and that includes being able to have medication available in case a kid can't breathe. Who doesn't want to help a child that cannot breathe? It's really easy to wrap around, and it's also important because it's so common. So 7.4% of children who are school age have asthma. And this is for all comers in the United States. So if you're in a classroom with 30 kids, there's going to be at least 2 students, and one can argue much more in a minute. And then leading cause of hospitalization, health-related school absences, although not all schools tell you why, asthma is pretty common, and asthma is a reason why our kids can't stay in school where they belong. And partially why stock inhalers are imperative to keep children to participate fully in school so that they don't miss their class time and they are able to reach their lifetime potential as an adult. Next slide. Now, when you think about health disparities in asthma and how we can achieve health equity, stock inhalers is one pathway to begin this route. And the reason is that percentage that I spouted out of people that are school-age children that have asthma is much higher if you're not Hispanic, Black race, or if you identify as Puerto Rican in ethnicity. This is a problem. You could be sitting in a class that has 35% to 40% in some neighborhoods with the asthma prevalence. In addition, asthma is more uncontrolled and you're more likely to die than those who identify as being of white race. There are also issues with financial barriers. We all know that sometimes when we go to the provider that we see, we will get a prescription and we might go to the pharmacy and it's insane. You are not able to provide that. Well, if you need an inhaler at home just in case, and at school just in case, and in your other bag that you take to the gym just in case, it's going to be very difficult to pay for those things. So a lot of people have issues paying for these extra inhalers and or getting them approved. But if you come from a family who doesn't have as much money for whatever reason, and a lot of the times families have asthma all throughout, and so if you had to miss a lot of work and you're not getting paid enough because of that, you are not going to have enough money to pay for these things. It's going to be hard for you to access asthma subspecialists. It's very difficult, especially if you're living in a rural area or if you're living in an urban area with not good exposure to the public transport system that can be easily accessed, or if it's snowing. These are all things that are being affected. We also live in environments where schools might be very old buildings that may or may not have been maintained. They might have exposures. We live near highways. We live near animal factories, animal production plants and farming that may cause us to breathe the air we have, and children breathe at a faster rate and be more affected by these things. In addition, those who are historically from historical marginalized communities have limited access to quality health care that provides them what they need in the setting of asthma guideline-based concordant care. So all of these things together create a situation that is unacceptable and in need of immediate change. Next slide. In addition, when we have children at the schools, they're going to have asthma symptoms wherever they are. And in some instances, kids will only be having the only exercise they will have at school. And so the number one reason for 911 to be called to a school for an emergency is actually for asthma or respiratory distress, which is the description of what it's like when somebody has a hard time breathing. It could be asthma, it could be something else, but in kids, it's very commonly asthma. Next slide. So the idea is how can we be prepared to avoid those? Not only are they costly, but it's frightening. It's frightening for a child to have to go on an ambulance ride by themselves or with somebody that they're not as familiar with, that is not their caregiver, to go to the emergency room, and they miss out on all that schooling and perhaps several days of schooling if they're not doing well. So to combat this, the idea is let's have something there ready, an inhaler, so that if any child or any staff member were to become short of breath at the school setting and they, for whatever reason, don't have their inhaler, perhaps it's because of the negative influences, social determinants of health, the inability to pay for it. Perhaps it's because they ran out. Perhaps it's because it's a child who's self-caring and forgets it. So 17 states, most of which amended the stock epinephrine laws, were able to pass similar guidance and or laws in making it available to have an inhaler ready at the school setting for a trained person to provide. Next slide. And the purpose of this is, we've discussed it, it's to really provide immediate access to address respiratory distress in the school setting, to avoid those 911 calls and keep children in class. An Arizona study showed that 84% of kids return to class after you give a stock inhaler, and they reduce 911 calls. That's exactly what we want to do. We want children to stay in school, and we want them to have a safe learning environment where they're not having exposures to triggers and or the inability to treat them if they were to have some symptoms come up. Of course, there's always the emergencies that will have to go to 911 anyways, that stock inhaler will help de-escalate those also as we're waiting for help to arrive. And we're really also supporting students. They don't have their asthma medicine, it's expired, it is on 000 on the counter, and or we have a lot of the kids that don't have a diagnosis because of that poor health access quality, poor healthcare access and differential quality that they might have received. Okay, next slide. So this is what we're aiming for. We want stock inhalers in schools because we want a safety net for our children who have asthma, whether it be diagnosed or not. We want to be able to de-escalate an asthma episode so kids can go back to class or at least feel better fast. And we're also having it there to be accessible. So if a kid is about to go run that pace or a mile run, and they have their asthma inhaler at the house, it's not going to be helpful. Instead of avoiding them from running, which is not what we want to support health and wellness and support running. You can give that stock inhaler to give them 2 puffs before exercise or whatever their asthma action plan may dictate. You can help diagnose asthma. It really supports the care coordination and communication we need. If somebody gets a stock inhaler and they have for shortness of breath and trouble breathing that's consistent with asthma, but they don't have a diagnosis, that's a very powerful thing to say, hey, look, wow, this happened. A family might have no idea just because the kid's not running around around their house. They only are doing it at school, and that's the only time they have symptoms. And it also helps the provider to say, oh, wow, I do need to pay attention to that. That being said, it does not replace the need for proper management. Stock inhalers doesn't mean that you don't get your own inhaler, doesn't mean we don't advocate for improved insurance policies and other policies that help support good access to medications and good access to guideline concordant care. Next slide. And further, stock asthma medication can promote health equity by making it available to everyone at all schools. And that can also allow for a reduction of emergency room visits for asthma from the school setting and or potentially outside if the child's triggered during a school day and they're able to de-escalate that emergency. Next slide. So why should you do it? I hope you know by now, but if not, we're going to tell you. We really want to build trust with families. If we're at schools and we're providing education, but other things come up. They're there for several hours a day. We want people to know that our school health within the school setting is ready to handle emergencies, and we can empower school nurses and staff to do something. It's really upsetting to be with a child or anyone that can't breathe, and you know that there's something that you can use to do it, but your hands are tied and you cannot provide something. Stock inhalers allows you to do something. And you can promote collaboration with healthcare providers. We all know that we're siloed. This will help facilitate communication from the school setting to the medical home of a child and to families, and help serve as a link that might already be there to some extent, but for those children who don't have that link, they may require a little bit of extra help, and this inhaler law and the implementation of it can be there to help. Next slide. So that being said, I'm an allergist, as we've mentioned, and myself and Rebecca Boston, who you'll be hearing from next, created a stock inhaler toolkit. And we did this in collaboration with Code Anna at the American Lung Association and the National Association of School Nurses. And the reason why is that we wanted to bring all of the tools and ideas. So if you're in state X and you don't know if you have a law, you can figure out how to advocate for a law. If you're in state Y and you do have a law, but no one's implementing it, here's how. If you're a district employee or administrator and you're like, I don't know what the heck they're even talking about, what is this stuff? You can learn how to create a policy because there's an example one. There's an example for pharmacies to learn. We've had multiple partners across the nation to help us provide this. There's also a link to the amazing American Lung Association training, which is to be uploaded soon, that will allow you to get the certificate. That will be a very nice way for anyone that's kind of generic enough for any state to use if your state does not already have an approved training. So please take a look at this and use this as you move forward with thinking about how to implement your state law and or creating one. All right, I think that's my portion. I'm going to come off the camera and let Barbara take back over. Thank you.
Thanks, Dr. Pavalardo. I think you did such a great job of really summarizing, why stock asthma medication programs are so important for schools. When it comes to stock asthma medication policies, different states and cities have unique challenges, and even the regulations differ by state and sometimes even within the state. So today we are fortunate to hear from experts in Arizona, Illinois, and Chicago, providing a diverse perspective on implementing these programs. Implementing a stock asthma medication program isn't just about having medication on hand. It's about a comprehensive approach that involves obtaining orders, funding the program, training, and community awareness. School nurses play a pivotal role in ensuring the well being of our students. With the right resources, knowledge, and support, they can really make schools safer environments for students with asthma. And some of these policies really can go beyond the school nurse, making sure that all school employees and personnel are able to recognize a child in respiratory distress and even respond. So today's discussion will not only shed a light on the successes and challenges of implementing stock asthma medication programs, but also provide guidance for schools and districts who are contemplating getting a program started of their own. And while each state may have their own nuances, I think there are some lessons to be learned from these shared experiences and best practices. So I encourage you to listen actively, take some notes, and think about some questions to ask our panelists, because we will have an opportunity for question and answer during our Q&A segment. If you think of a question, you can go ahead and enter it into our Q&A box. So up in the very top panel of the webinar platform, there is a Q&A icon. If you click on that, you'll be able to open it to submit your question. All right, so I'd like to invite our panelists to come on camera, and I will introduce Rebecca Boston, Megan Habich, and Nicole Pargas. Rebecca Boston is the Health Service Department Chair at New Trier Township High School District 203 in Winnetka, Illinois. She's been a school nurse since 2012 and is an Illinois Organization of Nurse Leaders Fellow from 2022. She's served as an active duty nurse in the United States Navy, and throughout her career has provided nursing care in both inpatient and community health settings. She is committed to increasing access to understand undesignated medication through her advocacy. Rebecca is a Health Service Department Chair um, there at New Trier. Okay, I'd like to introduce Megan. Megan is a nurse practitioner from Jefferson County Public Schools in Kentucky, and she's been there since 2009. Prior to working at the school public JCPS, she worked as a RN at Norton Children's Hospital for 5 years. Megan received her undergraduate degree in nursing from the University of Louisville in 2003 and her Master of Science in Nursing from Spalding University in 2008. In addition, she serves on the Kentucky Asthma Partnership Chair of the School Services Committee. All right, and Nicole. Nicole Pargas is the Director of Health Services for the Marana Unified School District. This school district, it's the largest school district in southern Arizona, covering 500 square miles, has 18 schools, with 8 of them being rural schools, and serves approximately 14,000 students. Nicole is a servant leader who has a passion for supporting the growth and success of her staff, as well as bringing programs to the district in an effort to support the families in her community. In addition to being a director of health services, she serves on numerous committees in Pima County and is a board member of the Arizona Asthma Coalition. So welcome, welcome, welcome. We're so pleased to have you here with us. So earlier at the start of the webinar, I talked about this stock asthma medication expert group that we pulled together at the beginning of the year. And we identified some of the most common barriers that schools experience when implementing a stock asthma medication program. So we're going to focus today's conversation on these 5 common barriers around obtaining standing orders of medication and devices, funding and sustainability of programs, training, standardized data and reporting, and raising awareness of stock asthma medication in schools. All right, so this, starting with obtaining standing orders of medication and devices, some of the challenges that we hear about is finding an authorized licensed prescriber for school, and then sometimes that resistance from healthcare providers to write a prescription in the name of the school, because these prescriptions aren't written to a child specifically, but to the school or school district. So I'm going to start. I'm going to ask each of my panelists just to talk a little bit about how standing orders work in your state. And actually, if I could, can I start with Nicole?
Sure. Good afternoon. So it varies across our state. A lot of larger school districts have medical directors. So the medical directors frequently will provide standing orders for a variety of things. So maybe over-the-counter medications like ibuprofen, Tylenol, Benadryl creams, things of that nature. So often districts will utilize the medical provider to issue the standing order for stock albuterol. We do not have a medical director in MUSD, so even though we are a very large school district, we have never had a medical director, so that presented a bit of a challenge for us. But fortunately, we have a really good relationship with our local health department. So the medical director for Pima County Health Department is the one that provides us with the standing order. She's a very busy woman, so I've learned to ask a couple months at a time. So usually right at the end of the school year, so our school year typically ends in May, right before Memorial Day. So in June, I'm already get my standing orders in place for the following school year, just to make sure that we have that, and then we can get the supplies in time. Other school districts in the area, like I said, it varies around the state. So other districts will work with local community health centers if that's not something, if they have a smaller public health department that maybe doesn't even have a medical director. We have that in Santa Cruz County. They'll work with a local community health center, and physicians will provide standing orders for them.
Great. That's really interesting. So even within your state, it's working a little bit differently depending on the school district. Megan, how do things work in Kentucky?
It's similar. It depends on the school district. I would say as far as connecting with health departments, medical directors, depending on where you're at, we definitely have some of those smaller settings and counties that have a more difficult time finding a healthcare provider to write those orders. In Jefferson County, we're fortunate enough that myself and 6 other nurse practitioners work for the district. So we're able to write our standing orders and train on those as well as for all of our staff. So we're fortunate to have that situation. And I know we connect a lot with the health department as well, but some of our other counties do things similar that they do in Arizona. They try to find local health departments, community health centers, as well as just maybe a family physician if it's a really small town in the area, to write those standing orders for them. So
Great. And Rebecca, anything working differently in your district?
It's pretty similar. At first, we worked with local healthcare providers, hospitals even, that had doctors that were willing to provide a standing order for a fee. So schools would pay them for a standing order. And eventually, some of our local health departments are now offering freestanding orders to schools, but not all of them.
All right. So any recommendations to our listeners today who may be kind of struggling with finding the individual to create? I heard maybe reaching out to your health department seems like a good strategy. Any other thoughts around helping people sort of get that process started?
I know one district in our area has utilized a parent who is a pediatric pulmonologist, but I think if there's just somebody in the community just as a resource who, it's just that networking.
Yeah.
But yeah, for epi and a few other things, one of the districts has a parent that's just very liberal and has connected them with resources for a variety of things, or even if standing orders may be easy to obtain, but then procurement of the medication can be an issue for some things and cost. So I would just say networking, and even if it starts with your parent community.
That's great. All right, one of the things I popped up on the screen here is a standing medical order. This is a template form. Uh, the Arizona Asthma Coalition actually has a form like this. This is something that we replicated for our training. So if you go through the American Lung Association's training, you can get tools like this template form to get started. If folks are trying to figure out, what all needs to be included in that standing order. All right, we'll move on into our next common barrier, which is around funding and sustainability. So, funding for medication, delivery devices, and supplies. We often hear that they're difficult to obtain. Most state laws allow schools to stock albuterol, so it's not really mandated. So, unfunded school mandates may actually put this undue burden on already underfunded schools. I'd love for you to share a little bit about how you were able to secure funding for stock asthma medication and the related supplies in your schools and school districts. And I'll go backwards this time, and maybe I'll start with you, Rebecca.
Sure. I also wanted to say about our previous topic, you could also look at the National Association of School Nurse website. And if school nurses are members of the National Association of School Nurses, there are resources there too. Some providers won't write a standing order when you first approach them, but if you say, I have this standing order from the National Association of School Nurses, this is something that's really common, they'll be more likely to help you.
Yeah. Fantastic. Thank you.
Of course. So with budget, initially, it depends on if you're paying for your standing order or not. It might cost a little bit more than $85 per school, but it doesn't cost a lot. So if you can approach your district administrators with an approximate cost, but also some data regarding like the number of students in your school with asthma, and then maybe the number of those students for whom you have asthma action plans or inhalers, there's usually a discrepancy, right? So if you have, let's say, a large school and you have 40 kids with asthma, of those 40 kids with asthma, you probably don't have 40 updated asthma action plans, and you certainly probably don't have 40 inhalers. So if you approach your administration with that information, that can be a reason for them to support buying a stock inhaler, because you can say this percentage of our school is likely to have an asthma emergency, and we wouldn't have any tools if we didn't have this. And then the other thing I would say is accounting for spacers when you're calculating how much money that you'll need. You can use plastic spacers that you clean. You can use disposable spacers, but just to account for that. And the actual medication itself varies by pharmacy where you fill it, but we just filled our prescription and it was $31 per school. And we got 2 inhalers for that $31. So that's really not expensive. And I think a lot of districts could justify spending that.
Right. Right. And the albuterol, it comes with like 200 doses. I know there are a variety. They come in different dosage amounts. So that's something else districts could think about is, what dosage amount you might want to get your inhalers in. But that could last you a good amount of time throughout the school year. Any other comments from Megan or Nicole about how you were able to secure funding for stock asthma medication and related supplies? Anything that differs?
We were pretty similar. One of the things when we started out the project, we had allowed schools to purchase it because we have about 150 sites in Jefferson County. So to try to get that budget allotment at the time, so we started with individual schools purchasing their inhalers, and we recommended what they should purchase and where to purchase them from, and we wrote the prescriptions. And now our goal is to hopefully be able to purchase those internally and be able to get them to the nurses. One for budget, the other just difficulty getting them in. We also worked with the health department and the Kentucky Asthma Management Program, and I was able to get some spacers and donate it from them as well to be able to distribute to the schools in addition to the inhaler. So that was able to bring the cost down a little bit, because if you get the reusable spacers, they are a little bit more expensive, but we found some of the same students come down to use the stock inhaler, so that way they can reuse their own individual spacers. So
one of the
Great.
things that I'll say, Barbara, sorry, is
Yeah.
there's also opportunities for statewide funding. We did get about 80% of the schools covered through statewide funding through Illinois, and I believe Missouri also has state funding. And so there's some advocacy potential there with your lung organizations to get the funding out, especially to the under-resourced counties and school districts that may require it, that if $31 for school is too much, especially if you have like 600 and something schools in a district, that might be something to consider. And then one of the things you have on there is the risk of liability. One of the things our toolkit has is it talks to you about whether liability is mentioned or not, and if someone's indemnified from liability. Or you could be indemnified from liability to administer it, and that's pretty much universal. But some states do and other states do not hold the provider that writes the prescription liable. But most of that, like Illinois, for example, does not. And so we had to get the word out about that in Illinois, and we saw more providers were willing to sign up for it after we talked to like risk management and malpractice companies and the confirmation that no, this is really a low risk procedure, and that it also does not. Also, like a lot of people have no idea what these are, right? Like they just don't understand medications. But if somebody were to be respiratory distress and it wasn't asthma, it's okay that they get albuterol.
Yeah. All right. And I did pop onto this slide just a little snapshot of sort of outlining some of the costs. Some schools report about $85 per school, but costs really do vary based on the number of inhalers and the supplies of valve holding chambers. So as you heard Rebecca talk about how she was able to purchase some albuterol pretty affordably.
We Banner Health, one of our large hospital organizations, provided us with the inhalers for the first couple of years. So they funded the cost of the inhalers through their pharmacy in the hospital, as well as the disposable chambers. And then this last year, we were able to procure a grant through Mercy Healthcare. So, so that was enough to fund over 600 schools in our area. So
great.
So cool.
That is cool. So partnerships sound like they're really important. Getting sometimes donations, and also just finding some champions to help support funding. Part of funding is also sustainability for your program, and this is often linked to being able to show impact and effectiveness through data and reporting. So, could any of you talk a little bit about how are there requirements in your state for reporting use of stock asthma medication, and kind of how are you doing that? Rebecca, do you want to go first, or anyone? Yeah.
Happy to share either way.
Yeah.
In Illinois, there's a state Board of Education website that has the reporting forms. So it is required in Illinois by law that if you use a stock inhaler, you report it within 3 days. There's a form to fill out online, and then schools can also maintain their own records. There are, as Dr. P was referring to, there are new programs where nonprofit advocacy groups provide a standing order. And if you have your asthma medication in order through one of those groups, they also might require you to report use to them.
Great. Any other thoughts from our panelists around this piece?
So we do sort of a double documentation. We have an electronics school health system, so it's school records and educational records in the school health. So our staff will document it there, and then our local health department, who is facilitating the program for us now, they have created their own data collection website. So we put it in for the health office visit for our system, but then there's a very brief, it's a Qualtrics survey is basically what it is. It's just a one-page few questions that we have to enter it into for their data collection, and it's basically for sustainability on their end.
Right.
So it's very simple.
And we're not required at this point to report it to the state, but our nurses do something similar. They document it in the computer system in the electronic health record, and then I have them document on a Google form so that I can have the data to share. It's just kind of as we've gotten the program and building it, that I'm trying to show the impact of what it is doing, and that's the best way that I've come up with so far. So it's double documenting, but at least we're getting specific information. So
yeah. Great. So hopefully that gave our listeners some ideas around some of the challenge with funding and sustainability. Let's shift gears to talk a little bit about training. So I think for some states like Arizona, who have been established, have been sort of doing stock asthma medication for a while, you know, I when the laws were written, there are sometimes training requirements in the state law. So like who should be trained, who leads the training, how frequently, um, and so I think some of the common barriers are sort of related to those kinds um of items and identifying really who should be trained, especially if there's no school nurse available in the schools. So I'd love to hear from our panelists a little bit around what strategies that you have found effective in training school personnel. Um, what have you been doing, like webinars? Do you have online programs? How is training working in your state? And maybe I'll start with you, Nicole, since I called out Arizona.
Right. I'm always hesitant. I want to be the first one. So we use an online training program through Western Region Public Health. It's a really good training curriculum. So our training requirements are 2 staff in every school. So we have health assistants in all schools. And then in our secondary schools, so that's our Ks, middle schools, and high schools, we have an RN and health assistant on site. So so the secondary level, the 2 staff that are trained are usually the RN and the health assistant. At the primary level, it's the health assistant and then whoever is sort of their backup, because the requirements have 2 people in every school trained in order to stay in the program. And it works out really well. The training is about a 30-minute online curriculum. We also do, just in our health services group, a competency skills check every year at the beginning of the school year. So we do an additional training for our staff, lumped in with everything else, like seizure training, diabetes, all those sorts of things. So they kind of get a little extra training. But that seems to work out fairly well. And we do it annually. So even if they've already been trained, our law and our policy doesn't state that they have to be trained annually. It just says 2 people must be trained at each site. But we just do it annually. there's other trainings that they have to do at the beginning of the year. So we just add that one to it.
Great. Megan, how about in Kentucky?
The state regulation for the stock medication just says that it can only be administered by trained staff. But within our state regulations, we also have a regulation that says each school is required to have 2 staff trained to give medications. So for our unlicensed staff, we use a program made by Kentucky Department of Education to train school staff for that. And so we in Jefferson County have incorporated our stock albuterol protocols in that program because they're already being trained on how to use the inhaler or nebulizer. So then they get the stock albuterol protocols and standing orders with that. We usually end up that way too, having more staff trained in addition to nurses or CNAs, because even though there's only 2 required per school to be trained on unlicensed or for the unlicensed staff, we have to have people trained if they're going on field trips or for some reason a nurse isn't there. So we try to get more than that to people. We do have a nurse right now in every school, as well as nursing assistants in many of our middle and our high schools. So that's how we've done that part of the training, is to incorporate it into that annual training, because it is required for unlicensed staff to be trained annually to keep that current. So they have to do it every school year. And then when we review things with our school nurses as well at the beginning of the school year. So.
Okay, fantastic. And Rebecca?
I think this really varies by district.
Okay.
Some districts are lucky and have nurses in every school, and some districts don't. So I think it varies based on who's staffing the health offices. There is online training that's really great. Actually, we have used Arizona's, and Illinois also has a really great training that the Respiratory Health Association put together. And then there are webinars that have been given recently through IDPH. And those have been a great way to get the word out and get staff members in schools trained and school nurses trained. It just depends on where you are.
Yeah. Okay, so trainings works a little differently, sort of depending where you are. The American Lung Association, recognizing that many states actually have their own trainings, we did create a training to help states that maybe don't have a training yet, or maybe they have a brand new law and they don't know how to get started. So this is really around implementation guidance for schools. But I think I also heard Megan talk a little bit about training other school staff on how to actually respond to asthma emergencies in schools. And so we do have a training that is specific to being able to recognize an individual in respiratory distress and be able to respond to them. And that's a little different than our stock asthma medication training, which is really about how to implement a program and what do you need to do. We do talk about recognizing and responding to someone in respiratory distress, but it's a little more robust and has many more components. So, okay, yeah.
I just wanted to jump in. I think that's a really important point. And there's a nurse practitioner in our district who made it a project through her DNP program to train non-medical personnel in schools on responding to medical emergencies. And her program's been really successful. It's an in-person training. It's about how to recognize these symptoms and respond with medications, and she uses trainers. And that's really helpful because there are a lot of administrators that are at school after hours when there are no healthcare providers around. And that's when sporting activities are, and maybe security personnel. That's been a huge audience that's been really grateful for this training.
Yeah, that's who I think about, like the bus drivers, staff that go on field trips, um, and coaches, things like that. So, all
And
right. Yeah.
we did, when we wrote our protocol, it's more of a protocol than a standing order, but the way we wrote it is with unlicensed staff in mind. So it was described, if they have these symptoms, then do this. And, if it continues, then give this, instead of just saying, so we would actually outline what their symptoms were. If they're doing this, then you give this, and kind of modeled the red, yellow, and green with the asthma action plans as well, so that they could hopefully easily identify what those signs and symptoms were, since without as much assessment.
I think that's a really important piece. That's also in that toolkit that Dr. P shared. It is what is respiratory distress. So there are like handouts and good information about that.
Yeah. Fantastic. All right. We'll move right along into our next topic around standardized data reporting. We touched on this a little bit, but for this, some of the common barriers we hear about are time constraints for school nurses and designated personnel who have to report this. There are helpful tools like from the Arizona Asthma Coalition, something that we adopted and put into our training. But sometimes there's little to no infrastructure for really obtaining data, which makes it hard and slow to measure effectiveness. There's no centralized database for schools to report or understanding sort of who needs to be notified. So I think those are often things to think about as folks are getting started. And so we touch on this a little bit, but are there so just remind me some of the methods and systems that you maybe have found like most effective with reporting. I think, having like a template tool like the event log, but then, being able to share this, are there key metrics or data points that are important to capture? Anybody want to start? I think some of this in our form here, we do ask about things like, when it was EMS called, did the child kind of return to class, that type of thing.
One of the things that I'm not, oh, go ahead, sorry, but I'm not seeing on the form is just that what did they have asthma before or not, or was it a new diagnosis?
Oh, yeah. That's good. Becca, did you have a comment?
No, I was going to say what Dr. P said, like, so do they have asthma? Yeah. Do they have an inhaler? And did they return to class, or did they follow up with the healthcare provider?
Okay.
Yeah, I would say the same thing for us. It's been pretty straightforward, and but just what their history is and then what the specific outcome is. And then if it's a student that we continually see, then we will add that information in, sort of that follow-up and case management piece of what we're doing to help that student out.
All right. Perfect. Okay. Our last barrier is around sort of raising awareness, and this is all about getting that buy-in from school administrators, from parents, and really being able to spread the word about the laws among pharmacies and pharmacists, among parents and caregivers. Can you share any examples of positive outcomes or success stories, I think, that have happened as a result of implementing your stock asthma medication program? Anything you want to share about your success and sort of, how did you raise awareness about your programs in schools?
I'll go ahead and start. I think a huge thing for us has been attendance. One of the things we noticed initially was a significant decrease in 911 calls. So that was great, because those students that we didn't have medication for in the past, and particularly those students that we knew were asthmatic and were sort of our frequent flyers, and we didn't have medication for a variety of reasons, if they had a significant enough asthma exacerbation, we'd have to call 911. Sometimes we could call the parent would take them home. And so that was unfortunate when we knew they didn't have to leave school. But if there was no one that could pick them up, or we couldn't get a hold of anyone, then we, have no other choice but to call 911. So that we saw an immediate decrease. I mean, that was just huge right there. But then ultimately, we really started to see in the long term the effect that it had on attendance. So like I said, those kids that would go home, get treated at home, because that's what parents opted for. It was just a game changer for us, that we could treat them so simply and straightforward and just keep them in school and send them back to class, and they could participate in PE, and and then we could move forward with trying to work with parents. And then the last thing I've noticed too is for students that move from out of state or have different circumstances that are new in our district, and they may not have medication, they may have an asthma diagnosis, they may have an expired inhaler, they don't have an inhaler that's ordered from a physician in the state, so then we can't use that, can't legally administer it if it's if the order is written from someone in another state. So then we can use our stock inhaler in a short term until they can get an appointment and get some follow-up care and get back on their regular prescribing dosage, that sort of thing. But at least we have the stock inhaler as a bridge for those students. So that's come up quite a few times. That's just been really nice.
Yeah, and that's a good example of how that data reporting really comes into this piece around sort of raising awareness and being able to educate individuals about the success of the program. Rebecca or Megan, anything to add around how you've raised awareness, either among school administrators, parents? To add with this one.
Think we're probably in a similar situation, and that's I did have administrators, I guess, at the beginning when they were purchasing their own, and they wanted to know, why do we need this? And, why can't parents provide their own? So it was a lot of education at that point, and going through what the barriers were to that, what the benefit of the stock albuterol was. We do have students who can't, they might have their inhaler at home, but the parent doesn't want to send it to school. So we have been able to use our nurses to educate families, especially when they're part of those attendance meetings, to let them know we have this medication at the school. I know we had a nurse last year during the albuterol shortage, when she had a student that she was pretty much treating daily with the stock albuterol, because the parent could not find an inhaler anywhere. And it wasn't for lack of trying, it just was, there were no pharmacies close to their house with that. So those type of things. And I think just being able to share those stories amongst the nurses themselves and then the other families, but definitely using that information to educate when we meet with the attendance meetings, and our social workers have been able to give the families that information, that it's available at school as well, so that it decreases some of that anxiety.
Yeah.
There have been a lot of students who've been helped by this, and I think parents are really appreciative, whether their student didn't have a diagnosis of asthma and needed it, or whether their student did have a diagnosis of asthma, didn't have their inhaler at school and needed it. Once parents realized that their student would have really been in trouble and wasn't, because the school was prepared, that's a really great way to build that awareness. But also, our administrators started coming to us. Maybe they were at a basketball game after school and another team had an individual with trouble breathing, and they said, "Don't you have an inhaler?" They said that to our principal, and our principal came to me and said, Do we have an extra inhaler if a student had trouble breathing?" So there's that kind of awareness. And then I think you mentioned pharmacists. I wanted to at least mention, at the beginning of trying to fill these prescriptions, we had trouble getting pharmacists to dispense medications to schools because there was no date of birth attached to the prescription. But the Respiratory Health Association worked with our Illinois Pharmacy Association to put out a letter notifying pharmacists about our law, and that schools could maintain a supply of asthma medication, and pharmacists were allowed to dispense it according to the Pharmacy Practice Act. So that was a huge win in raising awareness for pharmacists.
Yeah, that's incredible. So, well, this has been a great conversation. I cannot believe that our time has has come to close, but we've made it through all of our common barriers. I appreciate your comments and your participation in today's webinar to share a little bit about your success implementing stock asthma medication programs. So with that, it is, we are just at the top of the hour. I'd love to entertain any questions that our audience might have. And what we can do is we can certainly, if we don't get a chance to answer your questions, we can send email responses to your questions if we do run out of time here. We do have a few questions in the queue here.
I can answer the first two questions.
Yeah.
One was about, do students' names get reported? So when we report to the state the use of undesignated medication, there's no identifying information. So the student's name is not reported, their address, phone number are not reported. And then the next question was about single-use inhalers or multi-dose. How do you keep a multi-dose inhaler sanitized? So this medication can be prescribed different ways. We use multi-dose inhalers, and there are cleaning protocols, but we also use spacers. So you can use the same inhaler with a spacer for more than one student, and you also clean it in between uses, even with a spacer. I hope that helps.
Yeah, perfect. Okay. Ooh, there's a question in here about how stock asthma medication programs might affect or work with students prescribed SMART therapy. Has that come up in any of your districts? Not yet. Not yet. I do.
Yeah, so I think we haven't instituted that yet, but it's an excellent point. Like, my child actually has her Symbicort at school, and I have purposely been calling this a stock inhaler legislation with stock inhaler programming at the schools for that reason. And I think that the use of the ICS formoterol formulations that are available can very well be replacing albuterol over the next few years. I don't know of a district that has yet to do that, but I think it's a fantastic idea, and why I have been changing my way I approach it to be stock inhaler.
Okay, and there is a question here. I think we answered it, but maybe if we can just recap. How do schools get resources to pay for stock medication? So I think we heard different examples. Sometimes donations, sometimes through the health department. Any of my panelists want to expand resources to pay for stock medication?
One of the things you can consider is the PTO, depending.
Oh, yes.
They
Parent teacher
fundraise a lot of.
organizations.
I don't think that was mentioned, but it might have been. If not, that's another option.
Yeah. Yep.
And don't be afraid to ask. You know, you could bring up to your school board the need for this, that there are more and more schools with this available, and that you can give numbers of how many students you have with asthma and why you think this would be an appropriate thing to have in your health office.
Great. Well, we are just about 5 minutes over, and I want to be respectful of everybody's time. On your screen, we do have some calls to action for you. So we'd love for you to share any of the resources that you heard about today, especially those from our panelists. You're welcome to participate in one of our trainings online, responding to breathing emergencies, or our stock asthma medication training. We also have our first aid for asthma poster, which can be posted in offices. I do want to thank everybody for their participation today. Thank you to my panelists and Dr. Papalardo. I think this was a great opportunity for people to learn about implementation of stock asthma medication in schools. And so with that, I will conclude today's webinar, and thank you. Have a wonderful rest of your day. Bye, everyone.
Bye. Thank you.